Chapter 3: AI in Diagnostics. Role of AI in Disease Diagnosis. Examples of AI tools used in diagnostics. AI in disease diagnosis involves using advanced algorithms and models to analyze medical data and identify diseases accurately and efficiently. AI can process vast amounts of data much faster than humans, identify patterns, and provide insights that might be missed by human clinicians. Key roles. 1. Early detection. AI can detect diseases at an early stage, often before symptoms become apparent, by analyzing subtle changes in medical images or patient data. 2. Precision and accuracy. AI algorithms can achieve high accuracy in diagnosing diseases by reducing human error and standardizing interpretations across different healthcare providers. 3. Speed. AI can analyze medical data quickly, providing rapid diagnosis and enabling timely treatment decisions. 4. Assisting clinicians. AI serves as a decision support tool for clinicians, offering second opinions and helping them make more informed decisions. Examples of AI tools used in diagnostics: IBM Watson for oncology. Function assists in diagnosing and treating cancer by analyzing medical literature, patient records, and clinical trial data. Impact helps oncologists develop personalized treatment plans and make data-driven decisions. Google DeepMind's AlphaFold function predicts protein folding, which is crucial for understanding disease mechanisms and developing treatments. Impact advances in understanding diseases at the molecular level, leading to better diagnostics and drug discovery. Arteries function uses AI to analyze medical images such as MRIs and CT scans to identify cardiovascular conditions, lung diseases, and more. Impact provides real-time, accurate analysis, reducing the workload on radiologists and improving diagnostic accuracy. Path AI function analyzes pathology slides to detect cancer and other diseases with high precision. Impact enhances the accuracy of pathology diagnoses and supports pathologists in their decision-making process. IDOC function AI-powered radiology tool that detects critical findings in medical images, such as brain hemorrhages, pulmonary embolisms, and spine fractures. Impact speeds up the diagnosis of life-threatening conditions, allowing for quicker intervention. Case studies and real-world applications. Case study: diabetic retinopathy. Screening application: Google Health developed an AI system to screen for diabetic retinopathy by analyzing retinal images. Outcome: the AI system demonstrated high accuracy, comparable to that of ophthalmologists, and helped screen large populations in resource-limited settings where specialist access is limited. Case study: breast cancer detection application. IBM Watson for oncology was used to analyze mammograms and patient histories to identify early signs of breast cancer. Outcome: the AI system improved early detection rates and provided oncologists with treatment recommendations based on the latest research, leading to better patient outcomes. Case study: lung cancer diagnosis. Application: the National Lung Screening Trial, NLST. Employed AI algorithms to analyze CT scans for early detection of lung cancer. Outcome: AI-enhanced screening resulted in earlier detection of lung cancer nodules, increasing the chances of successful treatment and reducing mortality rates. Case study: COVID-19 diagnosis. Application: AI models were used to analyze chest X-rays and CT scans to detect COVID-19 pneumonia. Outcome: AI tools helped radiologists quickly identify COVID-19 cases, especially in the early stages of the pandemic when testing resources were scarce, contributing to more efficient patient management and isolation strategies. Case study: melanoma detection application. AI-based dermoscopy tools were used to analyze skin lesions and identify melanoma.